it is advisable to get maybe 12 months of Irish pediatric experience, because really working in the hospitals here, knowing the system will help you a lot. Because again, for me, my experience, I worked in Sudan and I did 2 years of pediatrics in Saudi Arabia, and the system is totally different than Saudi Arabia or Sudan. So you need to be exposed to the hospitals here to know about the system. Need to network with pediatrics doctors to help you with the application, to tell you about the interviews. You attend Zoom meetings like this, webinars that will show you a lots of tricks and tips of how to build your application and how to pass the interview or you get the training post here. You need to strengthen your CV and your portfolio. Again, your CV should show that you are committed to pediatrics, and you show that usually through audits and teaching and research that are all related to the pediatric training. And you need to show leadership activities as well. Like, for example, you are arranging the rota, for example, in the hospital where you work, or you are good also with the teamwork and how you solve the issues or the problems that arise in the work place. So by gaining this relevant experience in pediatrics, build your professional network and your CV, you can position yourself as really a strong candidate for the pediatric PST program. Then about the portfolio, and just wanted to stress on this pediatrics commitment things, the audits, the quality improvement projects, the teaching, and the courses like the basic life support, advanced pediatric life support, and the NRP and child protection. And you need to maybe present a paper or a case report or an audit in a national or international conference. That will help a lot. And again, about the leadership or service improvement, it will be good to show them that you are the one who's doing the rota or who developed a pathway or a guideline in your work place. So these are the most important thing about how you build your application and how you build your CV. And again, just before moving to talk about the timeline, what I said earlier about work here in Ireland, again, even if you didn't get the training job here in Ireland, working in Ireland will improve you a lot because there's a huge support and there's a huge mentality and culture towards doing the exams, towards doing research and audits and studies. And honestly, again, I worked in Saudi Arabia and I found it different than here, with all due my respect, of course, to the health system in Saudi Arabia or in Sudan. But the career progress, the knowledge, the experience that you will learn here, even if you are not in a training job, is huge, and it will help you a lot if you want to go back to the country where you are from, or if you want to continue here. It is all positive, and you win no matter what. And because at the end, our main goal, our main aim, all of us, is to help children, and working here in Ireland is really great and will help us a lot to grow and become better doctors. So again, the application timeline, it starts early September to mid-November. Again, you need to keep an eye on the RCPI website. As I told you, last year, the application window opened, I think, October and closed at the end of October. But this year, it's changed. So the application window closed already now on the 29th of September. So again, I hope you already applied and you are waiting now for the shortlisting. So after the application window is open and the application is accepted, then it will go through the shortlisting process. and that the shortlisted candidates will be offered an interview date, usually January, or maybe this year is going to be before that. And February, offers made and applicants match it to their posts. And if you are successful in the interview, then you usually start your basic specialist training journey in July. So this is just about the application timeline. Yes, it is slow and it takes time, but it is worth it. It is worth the wait. It is worth the efforts that you will make to build your CV. It is worth to apply. And this year also there is a 100 euro fee. It is worth the 100 as well. So about key dates. This again from the RCBI website. The applications close the 29th of September, and the application verification happens usually is going to happen next week, the 24th of October. Shortlisting outcomes will be November 7, and the interview date will be released around the 14th of November this year. I just put this slide. It's very important to talk about how they group the candidates and how they shortlist the people. So candidate group classification, group 1 is for Irish, UK, EU nationals or stamp 4 holder, and group 2 is for stamp 1G or stamp 1H holders. So the good thing about this classification is that for those who have stamp 4, their chance or the possibility of them getting, the interview at least, is similar to the Irish people, and this is great. This is really so great. And again, as I told you, things are changing here now in Ireland. I think in the past, stamp 4 was given like after maybe 5 years of you working here in Ireland, but now it's given in the first 20 months. So this is good. For those who have stamp 4, with a good, I'm sure like most of our Sudanese doctors, they have a great experience in pediatrics. And they have a good CV, and they are really very qualified to work and to get the training. So the fact that you can get a stamp 4 and you can apply and your chance is similar to the other people, then I think we have a good chance. And again, the priority is given to group 1 first, and group 2, the people that have stamp 1 or stamp 1G or stamp 1H are considered after group 1 is exhausted. But again, also there are few people from group 2 get that training as well. And there are some people that they get the training and they are not even working here in Ireland. It's also a good thing. So again, about the shortlisting criteria, and I feel like I'm repeating myself, but I think this is very important that when you apply, you show an understanding of general pediatrics, like the rule, the structure of the training, the system of pediatrics here in Ireland. And you need to show an evidence of interest beyond the routine exposure. So you need to show that you have done an audit or you have done a research or a quality improvement project that has something to do with the pediatric. So that will make your application stands out. Again, about the scoring overview. So scoring is 100 marks in total. You get 6 marks for the academic achievement. If you have done a research or audits, you get 10 marks for that. For the clinical acumen, you get 32 marks, and professionalism, 32 marks. This is in total. The enthusiasm and suitability for pediatrics is 10 marks. Understanding the pediatric landscape in Ireland is 10 marks as well. This is also another thing that some people they don't have. You need to check with your university, ask your colleagues if you have that in your university. Some universities provide official centile, document. So this style document just shows your rank in your batch. Like if you are in the top 10%, then you get a 6 marks, and this is an easy 6 marks, I would say. So you just make sure that your university provide this, because every mark matters. So if you got this marks, it's really great because it will help you a lot. So if you are in the top 10 in your batch, then you get a 6 marks for that. If you are in the next 20%, you get a 4 marks for that. And again, don't underestimate this kind of marks. It's very important, and it makes a difference, because again, most of the people that apply, they have strong CV, they have done research and audits. So to lose this kind of easy marks is not good for you. So just make sure that you have this when you are applying. For the research and the qualifications and using about the application this year, the RCBI are asking for the DOI or a link for a published journal or a published case report, or if you have done an audit or a research, they need a proof for that. It's not enough just to send them the PDF for this in this year. So for the MRCBH exams or equivalent, you get 5 marks for that. If you have done a PhD, you get 4 marks for that. Again, if you published in international journal as a first author, you get 3 marks. If you published in a national journal as a first author, you get 2 marks for that. And if you present it in a conference, an oral presentation, you get 2 marks for that, for the international meeting or conference. And for the poster, you get 1 mark. For the national conference or the national meetings, you get 1 mark for the oral presentation, and you get a 0.5 mark for the poster display or a poster presentation. As I said, this year you must include the DOI or the article link, and you are not going to get any mark without it. So just make sure that you have the DOI and the article link when you are applying. And only published work gets marks. No embrace or submitted papers, you will not get mark for that. And again, the abstracts do not count. They need full journal articles. And for conferences, you need to upload the PDF of poster or presentation and meeting program. Again, I just tried to break this down, and I know some of it just only gets 1 or 2 marks, but again, every mark matters. About the interview, I will let maybe Dr. Monica talk more about that. But in general, you need to know the structure of RCPI, pediatric, PST, and pathway to HST. And you need to demonstrate an understanding of the Irish pediatrics system. This is important. And you need to reflect on clinical cases that show teamwork, initiative, and professionalism. And you need to use clear examples and structured responses, and to stay calm, confident, and concise. But the most important thing that I would say here for applying for the basic specialist training, if you remember, I said the basic specialist training, you work as at SHO level. So in the interview, they want to see you as safe and a good doctor, a good SHO. So I mean, like some of us are again very experienced doctors, and some of us are really exposed to many things, and they are very confident people to make decisions and to do things on their own. And that's what we used to do when we were in Sudan, for example. They don't want to see that. I mean, like, for example, they say to you in the interview, you are seeing a 2 years old, 3 years old child, for example, with a barking of 4 a.m. in the morning in ED. What are you going to do? What's your approach? It's easy to say, yes, this child has croup, and I'm going to give him this medication, then I'm going to discharge him home after that. But they don't want to see that. They want to see that you are structured, and you follow the ABLS algorithm. You go the ABCD approach, and you show sympathy. You talk, you communicate well with the parents. You don't disturb the child. You don't distress the child, and and you escalate that to your registrar or your consultant. So things like this simple, and it looks like it doesn't matter, but they really concentrate on these kind of things. They just again want to see you as a safe doctor. It's not just about the knowledge that you have or the experience that you have. Uh, so common mistakes to avoid for the application: you don't need to miss or to have an incomplete documents. For the published papers, for the research or the audits, they need a DOI or the proof of publications. You need to show again strong examples of interest in pediatrics. You need to know that you are serious about pediatrics and you are a pediatrician. And you don't need to give an generic interview answers. Like, for example, you say, if they asked you why you want pediatrics, then you say, I love children. Everybody loves children, I assume. So they just want to know, give you something, to give them something original, something like real, not just a generic answer, something that you memorized before the interview. So you need to tailor every answer to the Irish pediatric training and your personal journey. So this is just common things people need to avoid. At the end, I would say there are alternative pathways outside PST, outside the basic specialist training. And again, we're going to talk about this later in this Zoom meeting. But the BST is your first step, and it's the most important one towards becoming a consultant here in Ireland. This is the standard pathway. The alternative pathways or the other ways of becoming a consultant work, but they need more maybe self-drive, admin, and portfolio building. I'm saying this because for me, I mean, personally, and I don't want to say I'm a lazy person, but I'm a person who prefers to be in the standard training rather than doing an alternative pathway, even if it is guaranteed, like at the end I'm going to be a consultant. So what I'm trying to say is it's very hard for me to go chase a consultant to sign things for me, to go and apply for work in other hospitals. I don't like that. So what I'm trying to say is here today, the main message is choose the route that helps you grow and serve the children best. Now I'm going to hand back this talk to Dr. Osman, and I'm happy for any question.
Thank you very much, Dr. Nader. It's a really thorough presentation. Just a few questions for me. I don't see any questions on the chat box, but just a couple of questions for myself. You mentioned that in the basic specialty training that you will work for 2 years. During those 2 years, is it the same hospital that you're working in, or do you rotate between different specialties? And what does that mean in terms of exposure for a junior doctor or an entry-level doctor at the basic specialty training?
Yeah, thank you so much, Osman, for this question. Yes, so for the basic specialist training, it's the 2 years program. In these 2 years, you work, you do 1 year of general pediatrics or emergency pediatrics or community pediatrics. This is for 1 year. And then you do 6 months of neonate. This is mandatory, and 6 months of a sub specialty. So for me, for example, I'm working here now in Sligo Hospital. This is the general pediatrics. I'm going to do this for 1 year. Then after that, I will go to do neonate for 6 months in the Rotunda Hospital. Then I will go to do respiratory in Cromlin Hospital. So this is going to be my subspecialty and the last thing that I will do. So you get exposed to different hospitals, not one hospital, and different specialties.
Great, great, great. So in terms of exposure, you get to see a wide variety of the pediatrics. Another small question, just if you could talk briefly, you mentioned something about stamp 4. Can you explain briefly what stamp 4 means and the difference between stamps?
Yeah. So yes, so when you arrive here in Ireland, you need a work permit, and you will be given stamp 1 when you arrive in Ireland. With the stamps, with the stamp 1, there are lots of restrictions. Like you cannot, for example, work in a different hospital or do any other business or work without a work permit. But the new thing now is that after 20 months of staying in Ireland here, you will be given stamp 4. So with stamp 4, you don't need a work permit to work in another hospital, for example, or to do any other business. So stamp 4 has less restrictions and limitations. So once you get stamp 4, things will be better and easier. Uh, and again, people get this stamp now after 20 months of working here in Ireland.
Great. Thank you very much, Dr. Nader Al-Dai. If you could still stay with us until the end of the day, that we can ask further questions regarding the basic specialty training.
So, yeah.
Our next speaker is Dr. Monica Salama. She is a third year specialty registrar currently working in the endocrine department in Tala University Hospital. She's an amazing doctor. I had the pleasure of meeting her and working alongside with her in the neonatology department. She's a great teacher, and I'm sure all of you will enjoy her presentation. Dr. Monica, please proceed with your presentation.
Thank you so much, Dr. Osman. I'm just gonna share now. Yep. And so I just want to first start by thank you to you, Osman, to SUI for inviting us, and a special thanks for our esteemed colleagues and our consultants, Dr. Sarah and Linda. I had the pleasure as well of working with both of them and with you, Osman. And I'm sure, Nadir, we will cross roads in the near future. Well, Nader has covered all the presentation, guys, so don't expect anything new from myself. He already covered all the important points, tips, and I think it will be the same when you apply to the higher specialty training in Ireland. So I'm gonna be quick, fast, but I'm gonna focus a little bit more on your interview. How can you grasp the attention? How can you present yourself, stand out in between the other interviewees? So let's go brainstorm few questions first. What's the difference between working in Sudan and Ireland? How can I get into training in Ireland? How can I be a good pediatrician, a safe doctor in Ireland? And how to deal with juniors, seniors, and what about the nurses here in Ireland? So I'm going to touch glimpses of all these questions throughout my presentation. I hope it's going to be fast and quick. So job opportunities, as Dr. Nader said, we advocate, we want to recruit as many doctors here in Ireland. Striking information, 1 in every 5 doctors here working in Ireland is Sudanese or have been trained in Sudan. So you have a good chance. If you're in Sudan or elsewhere with the Sudanese education, you have a good chance to come here in Ireland and work. First, the chance is much easier, of course, to establish a standalone or a service job as an SHO and registrar, and I found multiple agencies as well as Irish jobs. You can see now, this is like from today, they have 27 SHO pediatrics jobs advertised. So the chances are there is daily that you can look into it and just prepare your stuff, prepare your papers, prepare your CV, and you will 100% sure get a job. This is our training board that we have, and as I said, the higher specialty training application cycle starts in the 1st of October. The application process closes by the 29th of October. So you have, for those who haven't applied, you have 11 more days, or roughly 11 more days. Interviews will be done in February, March. Usually the BST uptake is 40 to 50 SHOs, while the higher specialty training, they take around 30 for the general pediatrics. And from now, we know that we can take 2 straight ahead to cardiology and 2 straight ahead to neonatology. So in this, I will be explaining the more about the structure of the higher specialty training, and I will explain how can you take like I specialize in cardiology and neonatology from the get-going. Now, the uptake of 30 HST is based on the hospital needs. We know for sure that next year we have the new hospital being open. So we have to tell you that you have to prepare, because we're expecting not this year, but next year for sure there will be a lot of demand for doctors all over the world. And as we know, Sudanese have a good chance in getting the training as well as standalone jobs. Can I specialize in Ireland without BST or HST? The answer is yes, and I will leave Dr. Sarah and Dr. Linda to enthusiasm us and enrich us about that. As Dr. Nader mentioned, the first step into getting to the higher specialty training is finishing your basic specialty training, and he covered that very well. But what if I don't have BST? What if I don't have basic specialty training? I've seen there a colleague of us called Isra. She asked, I have MD in Sudan. Is that counted? Absolutely, Isra. So all your pre membership years in training which done in structured governmental hospitals are counted as BST. Any years that you have done after getting the membership, which is the MRCPI membership, is considered as HST. So you have to apply for what we call equivalent program, and it covers 2 groups of doctors. The first group of doctors, those who have full training like an MD or structured training outside Ireland. You have to get all your papers, all your logbooks ready, submit for application. The application process might take about 8 weeks, 250 euros, and then you'll get that paper ready. The other group of doctors is the doctors who have been working here in Ireland before 2020, but whose internship was not recognized. I believe this will cover most of the Egyptian fellows who were working here prior to 2020. Again, what are the other pre-requirements to join higher specialty training? So we said you have to have BST or BST equivalent. The second is that you have to do your exams, which is the membership exams. There are 3 of them. Usually they're finished during your basic specialty training years. 2 is theoretical, and the last one is a clinical. It's similar to the membership exams of the UK, not much different. You have to show that you have enough documentation to demonstrate that you're eligible to be registered in the Irish Medical Council, and more specifically to the specialist registrar. It's not like there's no much paper, it's just a bit of more paperwork, but no much difference. You have to have proving competency of English language, which is your IELTS exam, the score is 7, your OAT exam, the score is B. And then you have to have all these paperwork ready, but above all, you have to show attitude, interest, passion about pediatrics. Nader mentioned it, under the current allocations and ranking purposes, there are 2 groups. The first group who will get the priority will be the UK, Irish, EU, and stamp 4 holders, and this is very good. So everyone who gets stamp 4 is treated equally to the native Irish citizens. And then the group 2 will be the other stamp holders. So we cannot go to group 2 until we completely fulfilled and exhausted group A. What about the structure of the higher specialty training? The higher specialty training structure is 5 years. You have at least 2 years should be done in general pediatrics / ED cover. 1 year, 3 months in community pediatrics, 1 year in neonates, then 1 year in different subspecialties. So for those who wants to go straight to neonatology or cardiology, so you'll get your first year as general, second year as neonate, and then from your 3rd year, you'll continue either neonate or cardiologist. You don't need to go to the other subspecialties or do the ED and the other stuff. So we have 2 allocations open for cardiology and 2 pediatric cardiology specialists and 2 allocations open for neonatology. This is one of the loveliest photos that I have. This is Cliffs of Moher here in Ireland. So I wanted to activate the right side of the brain quickly to tell you Ireland is beautiful. The nature is lovely. It's not only about medicine. It's also about the country itself, the nature, the beauty in it. Our work is tough. It's very stressful. So between the time here and there, find yourself a place and enjoy the nature in Ireland. Let's go back again. So the shortlisting criteria for higher specialty training, you will be there. They have marks for each category. So 5 marks for your qualification and education. And here we need more as a postgraduate education. So you need your membership exam, excellent. But if you have a master's degree or postgraduate diploma, this will add marks to you. Publication, audit, and experiences. So the amount of publication you have and the validity. By validity, I mean, or the value of it. So we can publish in a general peer review journal, or did we publish in a good journal like a BMJ or pediatric journal? So these also make a difference in the ranking. Then you will be given 6 marks to your clinical practice and sustainability in and suitability in Ireland, both or elsewhere. You have to show the passion, the experience, the interest in the pediatric fields. Then 2 marks is given for leadership management experience, which can be done through managing a rota, taking an NCHD lead, managing an MDT. And then 2 marks will be given for your teaching experience. And we all doctors work in hospital, we have juniors, but you have to have an extra niche that will cover your teaching experience. You must be involved in a structured, or you have to get yourself involved in a structured or tutorials, for example, that you prepare yourself to be given to your juniors. Hence, you will be given the extra marks. So you have to submit your application form online. You have to submit all the mandatory documents. You can save it as a draft because it's a long duration from the 1st of October until the 29th of October. You can save it as a draft until you have all your paperwork ready. And I believe the college will have Zoom drop-in sessions by the end, like towards the end of October. Just follow their website, the HST. Osman, if you can share the HST website, I have it there in my slides as well. They will have Zoom mean sessions that could help you prepare the documents as well as for the interview. So your document is your BSc or the equivalent certificate for the BSc, your postgraduate certificate, which is a membership exam or MSc or postgraduate diploma. Then you have your IMC registration, proof of English language, passport, or stamp if you don't have the Irish passport. What documents can make you stand out? What can strengthen your application? This will be your audit, your presentation, publication, and as Nadir mentioned, it has to be in a DOI form that you submit the publications. How can I stand out? Do you know, guys, how long does it take to make first impression on the instructors that will or interviewees who will ask you during the interview? 30 seconds. And half of that is just your general appearance, and the other half is your passion, your nonverbal language. So without even speaking, they have already had they already made the first impression. So come committed, look nice, look interested in the pediatrics, be passionate, try to engage all your panel, make good eye contact with everyone, and I'm sure you will grasp their attention and grasp their interest. So regarding the interview process, they will give you 20 marks on your CV, 20 marks on research, audit, and teaching. There will be 20 marks for a clinical for a clinical question and another 20 for another clinical question. So usually it's 2 clinical scenarios. And then 20 will be given, they say professionalism, but they won't be able to judge it. I believe it's more about how you show yourself committed to the discipline. You have to bring yourself enthusiastic, captivating, at the same time confident, comfortable, authentic about pediatrics. What happens as we are Sudanese, whenever someone asks us, we're very, very humble. We don't show off. But here in your interview, they please show off. They need to make sure that you are confident enough, that you have enough knowledge and skills, and that you can speak up in the interview. So my recommendation is prepare. The panel, usually we have 8 consultants. 4 of them will be asking you, and the other 4 will be writing down and marking you. So usually it's 4 to 6 questions. And the most important of all, tell us about yourself. So the 3 most important tips, it's not about what you want to say. It's about what they want to hear. How can you tell them, I'm a safe doctor, I will be your next trainee, I will be helpful in research, I'll be helpful in education? How can you structure that in a way, like in a short, summarized way, that you can get the job? You have only 2 to 3 minutes to tell us about your CV. That's all. So the opening gambit, for those who play chess, all the game is ruled by the opening gambit. So your opening gambit is tell us about yourself, tell us about your CV, what makes you a good candidate, why pediatrics, why training. They're all the same. They want to know who you are, and you have to come structured. You have to come very prepared. So if someone, like years ago, when I was asked, tell us about yourself, I was like, I'm Monica. I graduated from, and then I started, I like pediatrics in my 5th year. And then I graduated from Faculty of Medicine, University of Khartoum, 2015. I wasn't structured. That's not the proper way. The proper way is clinical, academic, management, and personal. I'll say clinical academic management because you have 3 minutes, so to cover all, you can come. Thanks for opportunity. I understand there are 3 areas in my career that will highlight I'm a perfect or a good or a strong candidate for this job. First, let me take you through my clinical experience, and you don't start from 2015 or 2010 when you graduated. You start by the most striking, important, like I've been working here in Ireland for the last 7 years. So when you hit that, then they know, he knows the system or she knows the system. They will be a perfect candidate for our cohort. So I'll give you the questions that I have received in my year so that you can brainstorm. Osman had this. We had a go in the past year when we worked together in the Kum Hospital. We went through the questions and how to answer them. So the first question was, tell us through about your CV, but leave out the research and education because we'll ask you about later. What is the most important thing that you're proud of in your CV? Tell us about your publication, research, audit, and teaching experience. There was a clinical scenario about a 14-year-old who came with hypoglycemia, bradycardia, and hypothermia. What will you do? From the get-go, you will be like, 14-year-old, this is a teenager. Most likely, why is he coming with all these presentations? Most likely it's an eating disorder. So you have to link in, be very fast, to be like putting on your detective hats and finding out what's wrong with that patient. What would you do first? And then they said he refused to do the assessment. What will you do? And here to test your challenges, this is like professionalism. How would you involve other team members? What is your plan in the hospital? How will you involve other teams? What are the complications? And then the question that the 5th question was, from your practice, what are the 3 gaps that are facing pediatric services in Ireland, and what would you do outside your work? So this was my HST interview questions. I'll be able, for those who's interested, I'll be able to get more questions from the previous years, and we can share later on. So a very good book that I recommend for everyone is Medical Interview. It's a comprehensive guide for whether BST, HST. It covers not only the easy, straightforward questions, which is like, tell us about yourself, but the challenging question, what will you do if a colleague came late? What would you do if you feel like there's a patient safety? This is what we call the hot potato questions, like what are the challenges facing the new hospital in Ireland? So dealing with juniors, seniors, and staff, the most common question I've been asked throughout my practice here in Ireland, are you Sudanese? And then when I tell them yes, oh my God, everyone keeps telling me about how good and disciplined and kind the Sudanese doctors are. And everyone, like Nadir mentioned, when he was working, everyone was telling him about Sarah. The same happens to me. Everyone is keeps telling me about my previous or my senior colleagues, which makes me very proud. This is our culture. We are representing Sudan in a good way, and I really hope that we continue to do the same. We share the same attitude, the same kindness, and we show them the same commitment and hard work in pediatrics. Juniors will learn from you, so you have to be kind and gentle with them, and you have at the same time put yourself in their shoes. Remember when you were struggling to get to the training, when you were struggling to find the job, that fear of, oh, what am I gonna do next? Seniors, you have to learn from them because they have gone through the pathway before you, so they know where you might hit hinders. And I'm really now enthusiastic to listen about the experience of Dr. Sarah and Dr. Linda when they got into the consultant job, and what were the challenges that faced them, so that I could learn myself in my applications. And staff nurses, they're the best tutors ever. You will learn from them, whether the kind or not. They are the best tutors, so they are your allies. Work with them. They have been here working for years and years, even more than the consultant, so they have a good power. Make them your friends, not your enemies. For any further information, you can access the HST guidelines, and you can contact at the help desk at RCPI. Another beautiful area from Ireland, this is Patrick. It's in the west. I lived there so many years. And again, this is to show you this is a beautiful country. You're going to enjoy the nature when it's not cold. And you're going to have fun. So come to Ireland, do your best to grab your paperwork and work more on presentation, posters, and audit, and then start as a standalone. And then once you get the chance, apply for training. Always apply for training. If you I got rejected for my BSc first year. I applied the second year. If you got rejected, don't worry. Just ask what went wrong, how can I be better, and work more, work hard. You will definitely get it. There is, like you can see, there are Sudanese doctors in the training, and the higher specialty training I'm representing only, but we have Dr. Ali Tom, we have Dr. Ala, Dr. Ibtihal. They're all my colleagues who are in higher specialty training. It's doable, but you just have to work hard. Thank you.
Thank you very much, Dr. Monica. As always, amazing. I'm speechless. Your presentation is really thorough and really good. We've all enjoyed it, and I'm sure everyone here enjoyed it as well. In the HST, you mentioned that it's a 5-year program. What are
Yes.
the struggles usually would face you during your HST period, the higher specialty training, and which areas in pediatrics would you be working in during these 5 years?
Thank you so much, Osman, for highlighting this point. So the challenges will be that every year will be in a different area. So you have to do 1 year in general pediatric, which is outside Dublin, but then the year of neonates and the subspecialty most commonly will be in Dublin, but then you get, like, it's not in a one fixed place. So the area of moving from one place to place, it might be difficult, especially for those who have family and young kids. The challenges with them being at school or crash is difficult, but my understanding is the college understand this, so they can make some exceptions. So if you speak up, if you mention the challenges that you're facing, they'll definitely help you. From a career point of view or from a clinical point of view, the challenging year for me was neonates because they are very, very small and fragile. But the best thing is that we worked in the COOM Hospital, which is a very, very well supervised, supported hospital, and I enjoyed the year. Eventually, we survived it and we did it well. So regarding the subspecialties, I'd recommend everyone to do 6 months in a different subspecialty. The commonest one will be the respiratory. Your GI is a difficult one or a long one, but it's worth it. The ED definitely gives you great experience. I'm doing endocrinology because I'm now interested in endocrinology more. So see whatever you like and then try and do 6 months in each discipline, and that will help you formulate, oh, I'm gonna be a general pediatrician, but I might be having special interest in some subspecialties.
Thank you very much. Another question is the language proficiency mandatory to get through the training if you're already registered with the IMC but hasn't worked in Ireland?
Well, if you haven't worked in Ireland, you have to get the English proficiency. And as I said, it's 7 for the IELTS and B for the OAT. But my understanding, and please correct me, everyone who knows, for those who worked here in Ireland, you get exemption from those. Like if you've worked here 2 years at least, you get references from your consultant about the English language proficiency, and you don't need to do them anymore.
Perfect. Thanks for explaining that. So that ends our first part of the day, which is the RCPI, the Royal College of Physicians in Ireland, structured program, BST and HST. For the second part of the day, we'll talk about the parallel pathway and how to be a consultant in Ireland without being involved in the structured program. So our speaker will be Dr. Linda Sharif, who is a consultant pediatrician here in Ireland and who also works as a clinical tutor in Limerick University Hospital. Please, Dr. Linda, walk away with the presentation.
Hi, sorry. Thank you, Osman. Can you hear me, everyone? Thank you, Osman, for the introduction, and thank you, the entire team behind the scene, for organizing the Pediatric Day. And the big thank you for SDUI to put all this work together, and it's really a very useful program. Thank you, actually, Nader and Monica. You have covered everything, and nothing left for us to say, actually, يا جماعة. لكن it's really what they have said. That applies for, I would say, all the specialties, and it applies for all the ways to get you to be a consultant here in Ireland. So I will start my talk. My name is Linda Sharif. I have recently achieved the specialist registration in general pediatrics via the parallel pathway. And there's few other names for the parallel pathway. You can hear equivalent pathway from some consultants or pediatrician, and the IMC now our kind of call it category category E application. So I'm going to go through that, and I'm going to highlight the challenges that I personally faced, and most of my colleagues also faced. So Bismillah نبدأ. Let's share my slides. So the first slide, who can take or who can do the equivalent pathway? So anyone who completed his membership, either the UK one or the Irish one, and you have an experience as a pediatric SHO in Ireland or international, and then you have, for the international experience, you have to submit the same BST form, which is the basic specialty training form. So if you have this and plus your exams, then you can apply for the equivalent pathway, and then you have to, it's either or, like plus or minus experience as a pediatric registrar, and I will tell you why this might help you in your application. And there is also an experience that you have gained before doing your membership that will be considered as a BST equivalent experience. So everything before the membership will be BST, basic specialist training experience, and everything after the membership will be counted as a HST experience. Then how to start? In our days, I don't want to say that, but in our days, we used to send to this email at the which is MCIRL, and they will send you back a big email with about 13 attachments. And nowadays, I heard that there is an easier way to do it. So if you log into your IMC, and then when you go to the home button, and then you press it, there is contact details, and then there is a registration content. And then you choose whatever item that you want. But for us here, it will be the request for a specialist application back, and then you have to choose the pediatric specialty. I would recommend you guys, everyone planning to go with the equivalent pathway, to do this today. And whenever you have this documents in your email, that means you're going to follow this road. If they have changed anything, if they decided all of a sudden next year that the pediatric ED experience going to be a year, then no, this is the back that I received and I'm working on this back. So if you're planning to go with this route, please do this now, and that will save you time. Even if you're thinking, I might not, just request it, keep it in your email and work on it. And then there is a really nice part of the RCBI that wasn't there when I started, but it's Sarah yesterday told me that it's now on the RCBI, and it's really good. And there is actually a video about an hour, around an hour, and it's really useful. It talks about the pathway toward the specialist registration, and it's really useful. So I would really advise you to go and see that video. It talks about different specialties and different ways, and what will let you do this easier. And it's really tricky and really good to listen to it. And my next slide is, this is the document that you're going to get from the IMC or from the RCBI, all these documents. And I'm going to go through a few of them, like the tricky ones. I'm going to mention them and to highlight what's the common mistakes that we usually face on these things. Now, so what is the program structure and duration? It's called the equivalent or the parallel pathway. So you have to, it's self-organized training, I would say. There is nobody training body behind you, so you have to do it yourself. So it's a very clear, so you have to, the training is the same. You have to have 2 years of PST training or equivalent. So either you worked SHO in Ireland or outside Ireland, and you have a proof for that. And then you have to finish your 5 years higher specialty training. So equivalent pathway means what I'm talking about now is the 5 years that Monica mentioned. But if you are, if you didn't work in pediatrics at all, then you have to see what Nadir mentioned, and that will be your PST. Or if you worked as a SHO, pediatric SHO, anywhere in a training center, then you have to submit your PST forms, and that will be counted as your PST, and then you can come to the alternative pathway. So it's a total of 5 years training, and 1 year can be done as a full-time research job. So from the 5 years, then you have 4 years now if you've done your research job, and then you can do a year of pediatrics plus 3 months of community pediatrics, and then you have to do a 12-month of neonates. It used to be like, people used to say it's a continuous block of a year, that's not true. You can do it 6 months, for example, in 2021 and 6 months in 2025. And this is my case. I didn't do the continuous neonatal training in a 1 year block. So you still can do it. Just you have to make sure your forms, your references are right. And I'm going to talk about this in a few minutes. And then when you finish your neonatology year, you have to do some subspecialties. So if you're done your research year, that's going to be 2 years. If you haven't done your research year, it's going to be 3 years. So the 3 years, you have to spend them in pediatric subspecialty. Preferred to spend 6 months of these 3 years in tertiary ED unit. No one's that's not written clearly on their what I would say requirements, but like every consultant works at the RCBI, or this is the advice that they used to give us, that you have to have at least 6 months of ED in a tertiary hospital. And then whatever subspecialties that you like or you will be able to do, then that will be counted as your subspecialties. All this poster, all this training has to be committed with on-call duties. So if you're done a shift without on-call duties, that won't be counted as your HST year or HST post. Next slide is about the training. So the training requirement and experience. So which hospital should I work in? That's an also tricky question. So you are allowed to, or not allowed, you're allowed to work anywhere, but I mean the post that's going to be counted for you when you work in a hospital that has an HST training in your specialty. So let's say Letterkenny, they have HSTs or SPRs in orthopedic, but they don't have SPRs in pediatrics. So your time in Letterkenny won't be counted as training year for your specialty. So make sure before you apply to this to your new post to make sure that there is a running ongoing, because some hospitals they had a gap in their specialty on their training. Some hospitals they started doing the SPR for some reason, stopped for a few years. So make sure that your time in this hospital there was an SPR training ongoing. What else about that? So there is like the pediatric hospital that they have SPRs running. It's very known, everyone know it, and always keep asking before you start the job. And this is the key. Like if you're around pediatrician, and I think we have our like our community, so please ask before you do anything in your training, because that will save you lots of time actually. طيب, what's the next point? Maximum recognized. Yeah. So if you worked in level 1 or level 2 hospitals, you're allowed again, but you're not going to take the benefit of more than 1 year. So make sure that when you work in Drogheda or when you work in Mullingar, that you don't spend more than 1 year. Anything more than 1 year in level 1 or level 2 won't be counted for you, so you're wasting your time. And what will be the, yeah. So the second slide is talking about supervision and assessment. Each training year must be supervised and formally signed off by a consultant. Make sure that all your documents are done on the right way. So each year, so whatever, like the common mistake that we used to face, and we used to actually, I did it myself, that when we go back and sign our papers, yes, I worked in Drogheda for 2 years. Okay, then I'm going to sign Drogheda the 2 years by one consultant. That won't be counted. Anyways, in Drogheda, more than 1 year won't be counted. But let's say you worked outside in Gulf area and you worked in a hospital for 2 years, and you get them signed the 2 years by one supervisor, that will be counted as 1 year. If you separate them, if one form signed by a consultant 12 months and the other 12 months signed by another consultant, that will be counted as a 2 years. So this is the check around. They counted my years, they didn't count. So you have to make sure what are you doing, and you have to make sure that you're applying it in the right way. The neonatal training requirements. So the neonatal training a year might be completed as a continuous 12-month or as a separate rotations. You can do 6 months, let's say, in one of the tertiary neonatal units like Rotunda National Maternity Hospital, Coombe, Crumlin, Cork, or 6 months in a tertiary neonatal unit plus 6 months in either Limerick University or Limerick Maternity Hospital and Galway University Hospital. If you worked in Limerick or Galway hospitals more than 6 months, it won't be counted as your neonatal experience. So the maximum neonatal experience that you can get from Limerick and Galway is 6 months only, and then you have to do another 6 months in either Rotunda or National Maternity Hospital or Coombe or Cork. And that's really important. I know sometimes we enjoy doing the neonatal shift, and it's a neonatal rotation, and we kind of go with the flow, but that won't be counted for you, unfortunately. Now, so what are the registration forms that I have to fill after each post? So each post that you are going to ask the college for you to consider it as a training, you have to submit 2 forms. The first one is the post HST summary form, and it's one of the attachment that I showed you there is a clear form called the post HST summary form, and the second one is the consultant reference form. So make sure after each rotation you fill these 2 forms, and make sure that all your paperwork completed before you would move to your next post, because you don't know what's going to happen in this service. ممكن ترجع تلقاهم they left the country or something. So make your life easy. Make sure before even like the rotation finished at July and finished at January. From the first week of June, start preparing your papers. Let's say start preparing them and get them signed, let's say by the first week of July. Don't leave 4 weeks gap from the time that you signed your forms until the end of the rotation. I know some of my colleagues, they have been asked to submit another form for the remaining time. So make sure that you prepare your papers before the last week, and then please don't take annual leave usually the last week of the rotation and the first week of the rotation. These 2 weeks are the most important weeks in your rotation. The first week is the time that, as Monica said, the consultant are going to take impression about you, and Irish people are very they take first impression for granted. So make sure that you are present in the first week of the rotation. Present yourself well, as Monica said. Talk to your supervisor. Tell him, what are you going to do? What's my plan? Don't just start the post and then at the end of the post look, this is my post HST summary form. What are you expecting him to do? It's not going to be easy for him to give you a good reference. And this is what you are going to, like, this is how are you going to make sure, yes, I did this training and this post ticked out of my to-do list. So make sure you finish all your papers. Make sure your supervisor from day one, when you started the job, he knows what are you doing here, what is your plans. For example, you have to discuss your plans. I'm looking to do any research. I'm planning to do audits. I'm planning to do this, and then he will take you serious, and he will give you the opportunity to join the team for doing any researches or anything. What else after that? So after you sign your papers, there is a clear stamp area, and it has to be an official hospital stamp. And this is what we face when you get your international experience. It shouldn't be a personal stamp. It has to be an official hospital stamp. There was some talk about, was the stamp, if it's written in Arabic, was that going to be considered, not considered? I don't remember anyone has a form signed well, filled well, and they just rejected because the stamp was in Arabic. So try to maximize. خلي البيبرز بتاعتك very standard, so they have no other option to say no for it. Work really well, and this process, it's long, it's very stressful, but it's worth it. At the end of the day, when you do your things, and my advice is do them step by step. Don't leave everything at the end of your year 5, then you go back and finish your things. You're going to suffer a lot when you do that. So try to do them from day one. And what I used to do is, let's say tomorrow is my first day in my training. I have to go back to the email that the college sent to us, and just go again and read the forms. And by the time you'll be able to know what does this form means, and that's going to be just part of your habit. So make yourself very familiar with the forms. Try to fill them on time, and that will make your life really easy. Next slide then. So this is the HST summary form. And it's very simple, very straightforward. All the information, right, like clear information. But see, here is the trick. The highlighted part was the post in a hospital accredited for training of HST. If you write no here, then this form is useless. They're not going to look at it. Even if it's international experience, you have to write, yes, I worked in a hospital that has Arab board or Sudanese board or whatever. This is the trick around most of the forms that rejected, and they didn't count their experience. They won't count any experience in non-training hospital. So you have to make sure to write here, yes, and there is evidence, there is part, we'll come later for the separator. There is a part in the separator you have to submit document to prove that the hospital that you have worked with is a training hospital, and there was a pediatric training running in this hospital. Now, this is the second, I would say, it's, I think, the same page of the first form, the HST form. And here is this is also a tricky question, and we used to do it differently. So on-call rota, so the minimal on-call rotas that you have to, you have to be in on-call rota, and the minimum rota on-calls has to be 1 to 8. So you have to work 1 call in 8 days. That's a standard. Anything rather than that, you're risking your training year. Now, when we come here to the research and audits and teaching experience, for research, I would advise you all to try to be involved in researches, because what you are doing today in your training is your CV later on when you're a consultant, and you really need lots of researches, not lots, but at least you need to tick. So you have to have few researches, few publications, few audits done, few teaching post or teaching training or teaching your team. If you're not interested in teaching, that's fine. You have to fill that in researches. If you're not interested in researches, you have to fill that in audit. Don't leave this area empty. Like, that's not for the sake of the registration, for the sake of your own CV later on. Because I think all the medical education now going toward these 3 things. And I think it was going for a long time, but now it's really important try your best to be involved in researches and teaching and audit. And this is what I'm talking to you about when you introduce yourself to your consultant. Tell him, I'm very interested in this. I never done this. I would prefer to do this. And I will come to that when I come to the management. So this is about the researches and audits. Try to be involved. If you don't have research, that's fine in this post, but you have to fill your audit. You have to do one audit per training year. So at the end of the training, you have to submit a minimum of 5 audits. I will advise you to do more and try to share. If you are first author in this audit, try to share the others. Like you can be working in 3 audits in the same year. And that's a really win for you. And you will see the benefit of this at the end of your training. Now, this is also one of the confusing pages I found on the HST forms. We thought, so the forms for your neonatal year and for your pediatric years are the same. And you have this even, like this is a one form for all the training. We used to kind of not to sign this for our pediatric training, but you can still get a neonate sick in ED who had ABG done or who had a CBG done or who came very sick and had enterosis done. So make sure you fill this page even if you're doing your pediatric training. But of course, you won't be able to administer surfactant. You're not going to put UVC or UAC when you're in pediatric rotation. But there is common things or like LB, CBG. So make sure that you take these ones. Yes. This is the same. There is nothing here. Why did I put that? Oh, yeah, here. This form is, again, there is community pediatric experience. So if you're not doing your community year or you're not doing your general pediatric with the community experience, you can tick it no. And this was also a confusing question. Neonatal intensive care unit for a minimum of 12 months. You can tick yes, and you can write 6-month experience in neonatal unit. And then when you submit your other neonatal 6-month, write the same thing. And that will be how to go away from continuous experience. So if you did it 6 months in, let's say, Rotunda, you can tick yes, 6 months done in Rotunda. Here it's just general information, like if you did subspecialty, just write your cases, and that's a straightforward question. The tricky question is down the management experience, and here they don't mean the management, patients management. It's about leadership and team management. So here, if you're involved in any committee, you have to write it here. If you are leading the managing the rota, you have to write it here. If you are managing the, let's say, the teaching schedule, you have to write it here. So don't leave this column empty, and this will be really you will see the benefit of this part when you're applying it for a consultant post. So work on your CV for few things to get registered for the specialist registration and to get your CV well prepared for your first consultant post. Now, the second form is the reference form. So everything that we have talked about was about the HST form. Now the reference form, which is the tricky one, because you see the HST form, you did fill most of the information. The consultant will sign it at the end and will stamp it. But for the reference form, you have your very limited part of the form to fill it, and the rest will be done by your consultants. So also you have to submit a reference form for each post. And previously in our back, it says that you have to submit only 5 references in your 5 years training, which is not the case, because when we submitted 5 references, they did ask us for reference for each post. So make sure that you have a reference for each post you have done, and you have to submit them. So if you've done, for example, the 5 years, you've done them in 10 years, you have to do reference form for 10 years for each post you have done. And you want it to be counted. So for example, if you've done, let's say, a post and you don't want it to be counted, that's fine. But as long as you have your 5 years and your 5 years post all has the reference form, you're safe and you don't really need to worry. The minimal training duration to be counted as a HST training is 3 months. So make sure if you're planning to move from this place to get this experience done or ticked for you as a HST, make sure that you spend 3 months on this post. If you're, for example, if you're going for maternity leave and you're thinking to take early maternity leave, just make sure that you completed 3 months, because this is the minimum that you can get for your HST training. And there is also a trick around the maternity leave. There is 3 months of your maternity leave can be added to your training. For example, if you have 2 maternity leaves during your 5 years training, there is a 3 months of this maternity leave will be added to your training. So actually your training will be لما تاخدوا 3 from 5 years تبدأ كم. So your training will be 4 years and 9 months. All right. So here is the reference form. The first page, this is the page that you're going to fill, straightforward information. You really don't need to do much. There is also a few skills and procedures you have to take them. Here, the form number 2 is the form that the consultant has to fill for you. And if you see here, if you see form number 2, there is 1 for poor candidate, 2 for inadequate, 3 for satisfactory, 4 above average, 5 excellent. Make sure that the reference form that you're going to submit to the college to sign you off for your training has to be at least 3. So your target is 3. Sometimes, for example, if you don't have research, they will take around 2, but that's fine. This is one of the things that's not really mandatory in the training. But let's say if you came across something, physical examination, and you got 2, that's not really going to help you to get signed off. And the last page is the tricky page that only like yes or no questions. And do you remember when I told you have to have at least an experience as a reg? Because one of the questions says, in your judgment, is this applicant capable for independent clinical practice as a consultant level? If you got this answered no, then this year won't be counted for you. So that's why make sure that you have enough experience to submit, like the person that you're going to give him this form, the consultant that you're going to give him this form, is very satisfied of your work, and he's going to sign you off for it. So if this is your first year as a registrar, this form will not, this part will not really help you toward your registration. All right, and then this, at the end of this, there's few questions and there is a final assessment. So he has to give you a number from 1 to 5 for your assessment. So always anything before, anything above 3, that will let you get signed off from the training. Anything less than 3, that will risk your documents to be rejected as well. Now, the second part of, is that the second now? Also, one of the mandatory requirements is you have to finish all these courses and to submit your certificate of completion of the course. One of the mistakes that I have done myself, that I did submit, مش هما, when you do the course, they give you an attendance cert, and when you finish the feedback, they will give you a certificate of completion. Just make sure that you're submitting the certificate of completing the course. One of the courses that we were struggling to get place for it was the child development disorder. That was face-to-face around Corona time, and we couldn't really get it easily. So make sure you finish your courses. This is one of the things also. Try to finish them as soon as you can. So your year 5 will be just collecting your papers. And there was a confusion around ethic foundations and ethics for pediatrics. Both of them are required in your pediatric registration. What else was tricky around the courses? The rest are fine, straightforward. All of these courses in RCBI website and under the HST courses, and they're straightforward. You just pay the courses fees and you can get them done. It's just not really available all the time. And there's few courses you might need to do them few times. For example, I did this table 2 times before my registration because it's only 2 years, I think. APLS 4 years, so also make sure that your courses are up to date before you submit your certs. Yeah, this is the tricky course as well, the Informing Families About Their Child Disability. This is one of the courses that you can't find it in the RCBI website, but it's a separate website, and you just log in, do the course, and then you will get your cert sent to your email after the course. Audits, one of the important things, as I said, you have to complete minimum of 5 audits during your training. I would advise you to do more, and 5 audits can be done in one post. So make sure that you have at a minimum of 5 audits by end of your training. You have to submit 2 audit report form where you have to write the audit in detail, and that they said it has to be your most recent audits, but I didn't really submit my most recent audit and I got signed off. So if you're happy about your most recent audits, just put them. If you're not, they're not really very strict about that. You can put whatever audits you like. And this is where you have to list your audits. If you've done more than that, list them all. Don't be very strict with the number, and you have to put the dates. And here you have to tick on the audits that you're going to submit report form for them. And this is the audit report form. You have to go and write the audit in details, the same way that we put it for any abstract or for any poster presentation. Now you finished all your requirements. There is something called Application Builder Pack. It's one of the attachments that the college will send you. And there is a really satisfying page. I find it the checklist. There's a first page of checklist. You have to tick everything that you have done and everything that you attached. And then there's personal statement as like a cover letter, very small CV, I would say. And there is 18 separator. It's actually very organized. It just, I don't know, I find it really useful. And each separator, for example, let's say, if you want to be super organized, let's say this week I'm going to work in separator 1, which is the checklist. Get all your checklists and put them in. Next week, I'm going to work on separator 2. That's the structured CV. Get all your cover letters and your CV. And actually, there is a structured CV form. So you don't really need to write your CV. It's written, your education, your master's or your certificates and your experience, clinical experience, like it's very, very structured way. And then the separator 3 here, you have to put all your basic medical qualifications and your MRCP or CH certificates. So all your certificates, you have to put them in. It's very clean and straightforward. It's just, you have to sit down and print all this paper and get a really good printer عشان ما تغلبكم في printing. You're going to print a huge amount of documents. So this is, I just put the 3 separators, but there is 18 separators, and it's very, very straightforward back. Then I'm done. I did my training. I did my documents. I'm ready to submit my papers to the Royal College, to the IMC, sorry. So if you completed everything, you see the separator, like you're going to have a big pile of papers on it. Make sure you put them in a safe envelope, because this is really all your future inside this envelope. Like cover it well. It has to be, there is one of the attachment, there is, they do send you a clear address for the medical council, right? Because there is a subdivision. I think it was category E registration office. So write it the same way that they wrote it to make your life easy. Send it as a registered post, and when they get it, they're going to send you an email. Dear doctor, we have received your category A application documents. Please go to IMC website and pay the 4,000 euros. امبارح غلطنا myself and Sarah. Was it 4,000 or was it 4,370 euros? So it's around that number. You have to pay it online at the IMC website, and you're done. That's a really big headache done. At that night, you will really sleep well, بعد ما تدفع 4,000 euros, and then you will be waiting then. The processing time, it's around 4 to 6 months, all right? And you have, after the initial assessment, if they said, oh, your papers and it's very, the way that they come back to you, there is something called written review. It's a folder, and it's very fair and it's very satisfying. Every 1 centimeter that you have done in your life and you did submit a reference form and post summary form, they're going to count it as a HST experience. You have to just really make sure you submitted the papers that they want. Very satisfying. They're going to look at all your experience. They're going to say, this is accredited for training, this is accredited, this is not, please submit this for this. Any document that you're going to submit after the initial assessment, you have to pay an extra 200 euros. And you have to do the same way. You have to put it in an envelope, just write the IMC or the address that they have sent. When they receive it, they're going to send you an email. We have got your documents. Would you please go and do the payment on the IMC website? After that, and then if your application is successful, happy days, you're going to get signed off, and automatically you'll be moved to the specialist registration. After your specialist registration, after you have moved to the specialist registration, you can also request something called Certificate of Specialist Doctor, which is CSD, and the other name for it is CSCT, which is a Certificate of Satisfactory Completion of the Training. It's also from the IMC website. You have to also pay around 105, and the processing time takes shorter, very soon actually, 5 to 7 days. And to get this certificate, 70% of your training must be completed in Ireland. So don't be excited. I have 5 years experience in Sudan. I have 5 years experience in Saudi Arabia. Make sure that the amount of paper that you submitted from Ireland, from your experience in Ireland, equal this 70% to get this certificate. Without this certificate, can I be signed off and work as a consultant? Definitely you can. You can work in Ireland as a consultant pediatrician without this certificate. But if you're planning to go back to the Gulf area, this certificate will really help you. And if you're planning to apply for fellowship, this certificate will help you. And I did attach so here you can get it. You can get it from here, from the IMC. You can just take Certificate of Specialist Doctor, the last option, and then it will take you to the payment link, and then you have to pay. And this is the certificate that you're going to get, Certificate of Specialist Doctor. Your name, your registration number will be written, and then when you see here the first line, is it? Oh, sorry. The first line, it says, has this candidate, or whatever the first line is, has satisfactorily completed specialist training in a specialty of pediatrics in Ireland. So to get this certificate, 70% of your training has to be done in Ireland. Now, the challenges. There's lots of challenges. I try to summarize them in two lines. And to be honest, the challenges in our time was more, I would say, than now. Now you have more clear pathway, clear references, and you can easily find the right answer. In our time, the way how should I say it? The road was a bit foggy, but I would say you're lucky to have all this, and it's very well recognized now. Everyone know it. Like in my time, when I said to the consultant, I'm doing the equivalent pathway, it was a bit, what do you mean? How are you going to, But now every single person know it, even the junior doctor know it. So it's very known. It's very clear now. And still there's difficulties. The difficulties in the parallel pathway, I would say, in getting your second job. So, you're not part of any training body, so no one going to tell you what to do, what not to do. You're leading yourself. It could be good for people like Nader, doesn't like it. So it could be good somehow for people that try to do their things step by step, and they're linked with the family, and they can't really move easily. And so it does help. It does work with some people, and it doesn't work for different people. So just getting the second job might be a challenge in the parallel pathway. And I would say one of the most difficult jobs is the neonatal post, because it's most of the time it's covered with the SPRs, with the higher specialty trainee. They take at least 10 every year, so there is no much space for service job. And the second challenge for the people that are going to go back and get their experience from international or their international experience, filling the forms can be a bit challenging. How should I say it? A bit hard, and because you're talking to different system, you want them to sign this regardless what they are doing there. It is challenging, and I would really advise you, take your form by your hand, go back to the place that you work, and get them signed by them the way that you want it to be submitted. You can ask someone who can do that for you, but I would prefer if you go yourself and get them signed and take them back with you. And that, I think, everything. Thank you so much.
Thank you very much, Dr. Linda, for this concise, informative presentation on the parallel pathway for general pediatrics. I'm currently not seeing any questions, and I believe everyone, you've made it really clear what to do and when to do it, and what's the right and excellent way of doing it. So that's really amazing. For the next presentation, our most senior, Dr. Sarah Kasha. I haven't had the pleasure to meet her in person yet, but I'm looking forward to it. She is a consultant neonatologist in the National Maternity Hospital in Dublin, which is one of the busiest hospitals when it comes to neonates and the maternity health. Dr. Sarah Kasha has a fellowship in neonatal transport along with a clinical research master's degree. So a really robust CV and reputation. Dr. Sarah, the floor is yours, please.
Assalamu alaikum جميعا. Thank you, Osman, for the nice presentation, and thank you, S2I, for giving me this opportunity. I'm really very delighted and very impressed to see a junior colleague, Osman, Nadir, and Monica, and colleague and friend Linda. So I'm going to talk briefly and wrap up this day about the neonatology training here in Ireland. So I'm going to share my screen. So I think, Linda, you should stop sharing yours. So neonatology is really very nice. I'll be biased if I talk about neonate. I'm very passionate about neonatology, and it was my dream job since I was in Sudan, and after that I moved to Saudi Arabia and here in Ireland. And as Monica mentioned earlier, in general pediatric training, they usually be around 30 HST posts, and every year there'll be 2 posts for the neonatology training and 2 posts for cardiology. So to wrap up and talk about neonatology here, my agenda is how to become a neonatologist in Ireland, what about the HST training in neonatology, and what are the neonatal fellowship and clinical research available. So working as neonatologist, you have 3 pathways. You need to have HST neonatology training. Other pathway is you have dual training, which I'm really recommended, which is HST in general pediatrics plus neonatology fellowship after your CCP. And the last one is alternative HST neonatology training. I think Linda and everyone mentioned before, it is very tricky to find a job in neonatology because there are 4 tertiary hospitals, 3 in Dublin, Rotunda National Maternity Hospital, the Coombe Hospital, and Cork University Maternity Hospital in Cork, and hopefully the National Children's Hospital by next year or 2027. So there'll be 10 posts in one of those hospitals for the structured training and 2 posts only for the standalone or alternative pathway. For the secondary level hospitals, we have 2 hospitals, Galway University Hospital and University Maternal Hospital Limerick, counted for 6 months for neonatology, but the rest of the 4 tertiary hospitals counted for 1 year neonatology training. So I'm going to talk about the structured training, which is neonatology by the HSC. First of all, you need to complete 2 years of the PST, as Nadir mentioned earlier. And after that, you need to complete a core neonatology training, which means that 3 of your 5 years of the high specialty training will be mainly on neonatology. So we'll take it one step. So the first year will be high specialty training in general pediatrics. The second year will be, again, high specialty training in general pediatrics, and sometimes it can be a neonatology year. During your second year of the high specialty training, you will apply for the neonatology training. There are 2 posts only. It is high competitive. You need to apply early. You need to have all your documents ready. And when you got a place for the neonatology HST, you'll complete the 3 of your HST training pure in neonatology. So what these 3 years include? So there'll be the first 2 years will be in level 3 neonatal intensive care unit. So we're talking about National Maternity Hospital, Coombe, Rotunda, and Cork Maternity Hospital. So this will be for 1.5 years. After that, you're left with 6 months. So we'll do them in intensive care unit, which is PICU in CHI Temple Street or CHI Crumlin, or 6 months in pediatric cardiology, or 6 months with the National Neonatal Transport Program. And after that, you're left with 1 year, minimum of 1 year. This will be a 1 year of out of clinical program experience. This means that you need to go abroad, overseas for a fellowship program, which most of the people here, they'll go to Australia, they'll go to Canada to have at least minimum of 1 year, but most of the time it is 1 year to 3 years fellowship program. Or if you don't want to go abroad, you want to stay here in Ireland, you can just do a research leading to graduate degree. So you'll end up with PhD, which needs to be completed in 3 to 4 years. You'll end up with a medical degree or a master's degree. So the 3 years of HST neonatology will be, as I mentioned, 2 years in level 3 NICU, including 6 months in PICU, cardiology or NNTB. And after that, you have a year of a fellowship abroad or research job here. So the Faculty of Pediatrics in the Royal College of Physicians of Ireland, they have a document about the higher specialty training of neonatology, and they keep updated every year. So this year they have the up-to-date document for 2025. You can find everything about neonatology as a subspecialty. So when to apply, how to apply, what are the requirements, and what are the courses, what they want you to do during your return, everything is written here, and it is really very useful for someone who wants to pursue a career in neonatology. It is available, and as I mentioned earlier, they usually update it every year. So the second option to become a neonatologist here is the dual training, which is really the best thing to do. So this means that you complete your HST training in general pediatric, you obtain your CCT in general pediatric or CSCT if you are doing the alternative pathway. After that, you'll go and have 2 years of neonatology certified training both with a fellowship, overseas fellowship in US, UK, Canada, Australia. Or if you want to stay here in Ireland, you can do the National Transport Fellowship as I have done, which is a 2 year. 1 year will be a clinical job and 1 year will be a research job. And this is really very useful because by the end, you'll be general pediatrician and you'll be a neonatologist. But if you complete your training only through HST neonatology, you're only going to sign up at the specialist registration of neonatology, not on the general pediatrician, which means that you'll be able only to work in tertiary level hospital or secondary level hospitals, which if you want to stay here in Ireland will be Dublin, Cork, or Limerick and Galway. But if you have a dual training, you'll be signed as general pediatrician, lots of opportunity all over the country. Or if you want to go outside Ireland, you want to work in the Gulf countries, you want to go to the UK or other countries, still you have a good opportunity to work as general pediatrician and neonatologist. And I say the very hard one and challenging, as Linda mentioned, is getting the HST neonatology training via the alternative pathway. So the first thing that you need to have a BSc equivalent. If you have any training prior to your membership, they'll count it as BSc equivalent, or even if you did a BSc, but you didn't get a chance to get an HST, so this is all BSc equivalent. After that, you need to do a 2 year of general HST, and the challenge comes when you need to do a 3 year pure neonatology training. And as I mentioned, there are only 2 posts for the standalone, for the service post in one of the 4 tertiary hospitals. And also there is 2 posts at level 2 hospitals. So the challenge comes through the 3 years because it's really very difficult to get the 3 years in a neonatology training. So the best way is to go to the second option. You complete your general pediatric training, and after that you go for a fellowship abroad, or you stay here doing an MD, PhD, or even join the transport team. So talking about the fellowship and research for the neonatology field, you can go outside, is the best. If you have no family commitment, if you're still young, not in our age, I'm not including Linda, it's only me. So you can go to Canada, you can go to Australia. You have 2 years of fellowship. You need to apply early. For example, if you're planning to go in 2027, you need to apply from now. It needs at least 1 year before the fellowship starts. You'll go after you complete your training here, get your fellowship done. You'll come back and you'll have lots of opportunity. The second option, that's what I have done, is to join the neonatal transport team. I have lots of commitment here. I have small kids. My husband is working full time, so I can't go. And I have done a lot. Like I work in Sudan, I work in Saudi Arabia. I'm not like, I don't want to go for a sports journey. So that's why I stay here. I did the transport fellowship, and that's give me this job what I'm doing now. The search option will be the research fellow. So there'll be a research ended by an MD, 2 years, or a PhD, 3 to 4 years. You can do it at the Trinity College or do it at the RCSI, UCD, or Cork University. They're well recognized, they're very nice jobs. While you are doing your MD, you can still do your clinical part, so you'll still cover shifts. you still earn good amount of money, and it is good time to know to build up your network and to get a job in the future. So that's basically what is covering for neonatology. I know my colleague they cover everything, and I'm happy to take any questions. And also, I'm happy if anyone would like to submit his application through the alternative pathway. I'm more than happy to review the application, go through everything, because in our time it really was very challenging, but now it's getting very easy. And now Linda mentioned that even at the RCBI website, they put a package for the SDR with a very useful videos. Everything is straightforward. Everything is clear. You have us. You can ask any one of us, and we are more than happy to help everyone. And all the best for whoever joined Ireland recently or anyone who wants and plan to come. And it is very nice country. They're very welcoming. And for myself, like I have a really very nice experience with everyone. Thank you. And thank you, SDI again.
Thank you, Dr. Sarah, for a lovely presentation as well. So we're gonna wait a few minutes for questions here, and I have the first question, maybe directed to both of you, Dr. Sarah and Linda, from Amna. Dr. Amna asked, can you clarify more on the fees the fees point, the 4,000 euros? What is that fees represent, and what is it for? And why is it required for the initial assessment?
Will I go for this, Sarah?
Yeah, go
Amna,
for
that's
this because
simply
you just recently
because that's
signed
the
off.
area that hurts me. Amna, this is just application fee. The 4,000 euros are just application fees. And if the college came back to you that you have to submit extra documents, every extra documents that you're going to submit, you're going to pay an extra 200. So for example, I did one of the courses, I did submit the attendance cert instead of the certificate of the completion of the course certificate. So I did pay 200 euros for that. So that's why, guys, it's not one person process. Really, it's very stressful. It's a really big pile. Like you're going to submit a 3 kg baby size documents. So make sure that there's someone, not someone, I was talking to Ibrahim and Sarah, both of them. So you make sure that you have your backup, that you don't have a body, but you have lots of your colleague are going to support you very well. So it's not a one person process, guys. You have to make sure that there is someone doing your first, as if you're doing a scoping review, someone looking at the paper first, there is someone who has to check, and there is another person who has to check after him. To minimize the time, it's very stressful. Apart from being extra, it's very stressful to be every now and then you have to submit other things. So the best way to do it from the first time, right? One shot, and that's it.
And I'm sure Dr. Anna is asking because I know that she's on the doorstep of the registration. So good luck, Dr. Anna, with the registration. Do we have any further questions for Dr. Sarah and Linda? May I remind everyone that we've shared a couple of few useful links on the chat. And also to remind everyone that there is a document directed for the interview information also shared on the chat box. If you could have a look at that, please. Another question for maybe Dr. Sarah. For the CSD, do we need a research or an audit and also teaching experience for that matter?
Yeah, definitely you need it because in each post you have the post HST summary form, and there is a big box to tick is about audit and research. So try whenever you start your job, as Linda mentioned, at the beginning of the job, you need to mention to your mentor that this is what I'm doing. I would like to start my audit or research early. By the end of 6 months or 1 year, you have everything done. So it is mandatory, and there is no excuse that you don't have an audit and research. And even when they send you the evaluation report from the postgraduate body, from the RCBI, they'll mention that if you have not done enough audit and research, they'll comment about that. And this is something can reject your paper. So make sure that whenever you start any new job, you have your audit early So that's what I'm doing now with my mentee. So usually I start when I meet them the first week of the rotation. I give them, this is your audit for the rotation. Start early. 6 months is going to pass very quickly. You need to finish up within 6 months, especially for the standalone. So this is mandatory, and there is no anyone who can like take part and not like it is mandatory thing for the post HSC form and to have your papers signed.
So in summary, the audits, the research, the teaching experience is really useful at any level of the pediatric specialty. So if whether you are a junior, you're doing your BST or their HST, or even aiming for the parallel pathway to become a consultant, the research audit experience it can boost your application and can make you stand out from the crowd when it comes to application in every way.
Exactly. And this is something that we deficient and back home. We usually very good as clinician. We have a great clinical experience, but usually this is the part that we need to work. We need to work on our audit, our research. Don't shy. All the time participate, all the time just volunteer that I would like to do an audit, I would like to start on a research, and it is really very useful. And even if you are interested in research, you can just do a master degree in one of the universities. This will give you a good knowledge before you start. But it is one of the things that you need to start it earlier.
Another question from Dr. Muna here. Would any previous experience in, let's say, in the Gulf area or in Sudan would be of any benefits of directly registering to the E category in terms of if they get signed forms from their consultants over there, would that be useful in obtaining the specialty registration?
I'll leave it to Linda.
Yeah, that's definitely, if, as I said, any experience before the membership will be counted as BST, but you have to submit the right form. And any experience after the membership will be counted as HST, but you have to submit the right form. It's all about the right form. It's about the way that you're presenting yourself to the RCBR.
But again, Linda, I want to emphasize on this point. You need to work in a recognized training
It has to be
hospitals.
recognized.
So
Yeah,
it needs
has
to
to
be
be a
training
recognized
hospitals. It's
training
the same
hospital.
as here. So
Yeah.
you can't work in a DDH hospital or you work in a primary health center. Nobody will count it.
Yeah.
It needs to be from
It
a
has-
tertiary training hospital.
Yeah, and you have to do all the duties, like you have to do calls, audits, attending teaching. It has to be similar to the training here. So that's why if you're working there in Gulf area and you're thinking to come here, try to join one of the teaching hospitals. That will give you a really good push. Like experience-wise, you're going to be working in an environment similar to what we're doing here, and that will help you to sign your papers as well.
Great, thanks for that. And the question is for all of you, our speakers tonight. Is there any specific, like for junior doctors, is there any specific like research projects or topics or areas of research or master degrees that you would recommend and that you think will be really useful for the junior doctors or even our senior colleagues who are trying to kind of obtain the parallel pathway? Would there be any specific master degrees that you would recommend and think it's really helpful for someone to maximize their chances?
To get signed off for the parallel pathway, you don't need any masters. It's not one of the requirements, but I will advise you to do masters, to work hard on your CV, because that will be your CV as a consultant later on. All right?
Well, might add to that, for HST, when I applied, like we are applying with Irish and EU members, so they have very good CV and very good experience. And in order for you to compete, you have to be at least 10 to 20% better. And I think the masters, that was the one that given me the chance to compete. I would recommend doing masters in or postgraduate diploma in clinical research, because this will make your life easier when you do the audits, when you do a research. You will be understanding the statistics, the whole point of how you design your study and how you do the analysis. There's also a master's and postgraduate diploma in education and in clinical simulation. Now the world is shifted from regular tutorials and studies towards doing a simulation studies. So using AI in technologies in medicine, this is the future for medicine and for pediatrics. And there are postgraduate diplomas and masters, I believe, from Galway University Hospital. That's where I got my master's, as well as Sarah. Together we were colleagues at the time, and I would definitely recommend it.
And also there is thing that I would like to add. The master fee is very expensive if you are counted as non-EU. But if you live here in Ireland for more than 3 years, you'll be counted as EU, so you'll only pay for 25% of the master. For example, now I'm doing an MD. The fee for the MD for 1 year is 14,000 euro, but because I am EU citizen now, I'm just only paying 5,300 for my MD, which is like, this is lots of help, so try just to get this chance.
Yeah,
And
just
also there is the TSS that can help
exactly,
you.
that's it. Yeah, the
Exactly.
TSS,
So you
yeah,
won't
was
be paying it the full amount. The TSS, the program that support the trainees. I'm not sure for BSTs, HSTs, you have 2,000 to 2,500 a year. So you can get that, and that can also be funded towards your master's degree.
So the TSS, guys, is the training supported scheme, which supports the doctors here with a certain amount of money to complete courses, master's degrees, education, and elements in general. For someone who is not in Ireland, who's not physically in Ireland and looking for a master's degree, do you think a master's degree abroad would be recognized here to some extent for someone who's not in Ireland?
Anything, whatever you have done, it will be counted. Don't ignore even like if you have diplomas, if you have courses, everything is counted. Try to work hard, because whenever they see that you have continuous passion, there's no break in your CV. This will show that you are enthusiastic, you're working in your career. So don't ignore any minimal step. Even back home, if you have any diplomas from Sudan, or if you have any master degree, they'll be counted here as an experience. So don't ignore all this.
That's great. Thank you, Dr. Sarah, for that. So I believe this concludes our presentation for today. So in summary, pediatric training in Ireland is not impossible. It's not just me, Dr. Monica, Dr. Sarah, and Dr. Linda, and Dr. Nader. It's so many of us here in Ireland in the training or outside the training looking forward to register as specialist. It's not easy.